Bismillahirrahmanirrahim. Assalamu alaikum. It's me, Mehver Saad. My roll number is BP1450117 and my group number is 51. The main topic of my presentation is transition through menopause and the subtopic is hormone therapy. Okay, so I am going to discuss about menopause. Menopause is when a woman stops having periods and no longer be able to get pregnant. Disease, but rather the point in a woman's life at which she is no longer fertile and menstrual periods have ceased. During this time, ovulation stops and estrogen hormones drops. And here's the picture of the symptoms of the menopause. And the symptoms include sleeping difficulty, memory loss, headache, vaginal dryness and pain, mood changes, and etc. So, why does menopause occur? Menopause is when ovaries age and produce less reproductive hormones. Menopause occurs at a lower level of estrogen, progesterone, testosterone, and follicle stimulating hormone, luteinizing hormone. Now, what is hormone therapy? Hormone therapy may include giving hormones to the patient or using medication that decreases the level of hormones in the body. Basically, hormone therapy is used to control the symptoms of menopause. There are two types of hormone therapy: estrogen therapy and progestin hormone therapy. As I have told you before, that menopause occurred due to the lower level of estrogen. So, for maintaining the estrogen level, we going through estrogen therapy. And progestin hormone therapy is also called combination therapy because in this form of therapy, doses of estrogen and progesterone are taken. Now, let's discuss the case study. BD is a woman, her age is 52 years, and she has been having a sudden feeling of warmth over her chest, accompanied by a patchy flushing of her skin for the month. She now visits her physician because she has been waking up shivering from the perspiration gown nightly for the past week. She has not had a menstrual period for the last 7 months. Her physical examination was normal for a 52 years old woman. BD has tried lifestyle modifications for management of her hot flushes without much relief. Her physician is recommending her hormone therapy, but she expresses concern about its risk. How should BD be counseled about the risk and benefits of hormone therapy? Here I am discussing the SOAP notes. So let's first discuss the subjective. Age 52 years old, gender female, chief complaint feeling of warmth for past month. Menstrual period is skipped for 7 months. And the objective is vasomotor symptoms, that is hot flushes, sleep deprivation, that is insomnia. Now let's discuss assessment. It seems that BD is experiencing hot flushes, a vasomotor symptoms experienced by 50 to 85 of all women during the menopause transition. The exact trigger for the hot flushes is known, but they are clearly associated with the declining estrogen concentrations that occur during menopause. Estrogen therapy is more effective than placebo in reducing hot flushes, and withdrawal of ET results in resumption of hot flushes. Now we have plan. As BD has tried lifestyle modification, that is avoidance of hot beverages, warm environment, regular exercise and relaxation techniques. For management of her hot flushes without much relief, now her physician's recommendation is hormone therapy. But she thinks, is hormone therapy is beneficial or not? So let's discuss the benefits. Hormone therapy is prescribed to relieve hot flashes, night sweats, and dry, itchy skin. Reduce risk of developing osteoporosis and bone breakage. Improvement of mood and overall sense of mental well-being in some women. Lowered risk of colon cancer, diabetes, and tooth loss. Lower death rate for women who take hormone therapy in their 50s. And let's discuss the risks of hormone therapy. So, the risks include an increased risk of endometrial cancer only if a woman still has her uterus and not taking progestin along with estrogen. Increased risk of blood clots and stroke, but using estrogen as patch cream might further lessen the risk of blood clots. Increased chances of gallbladder, gallstone problems. Younger women in the WHI study had fewer risk and more benefits as BD in 52 years old. Such study showed HT started early in postmenopausal women significantly reduced death rate, heart attacks, and heart failure. And these postmenopausal women who started HT earlier and use it for more than 10 years were not at increased of breast cancer or stroke. So regarding the benefits, BD should be convinced for hormone therapy. And this is the end of my presentation. All like that.